Welcome back at 6:23. So when depression doesn't respond to typical treatment options or medications, there are other options available. Joining us this morning is Baptist Health Dr. Kristina Kennedy, a psychiatrist, with some treatment options for depression. Dr. Kennedy, thank you so much for being here.
Of course.
So, Dr. Kennedy, when a patient has been diagnosed with depression and the typical treatment options haven't worked, what other treatment options are available?
Yeah, so today I wanted to talk about some kind of innovative treatment options, usually that we refer to under the category of interventional psychiatry. And these are more procedural-based treatments. So three that I'm going to kind of brush on today are esketamine or Spravato, and then also TMS, which is transcranial magnetic stimulation, and ECT, which is electroconvulsive therapy. The first one, esketamine, is usually a medicine that's sprayed up the nose. TMS uses magnetic stimulation to stimulate those parts of the brain that are a little bit under-stimulated in general. And then ECT kind of does the similar thing, but it's a little bit more invasive than TMS.
Well, some of those sound intense. Talk to us about that.
Yeah, so I think people have a lot of ideas about ECT especially. You hear about electric shock therapy, and I think that goes back to just kind of the history of how it was done, because you probably are familiar with that treatment, but it's done a lot differently than it used to be back in the day. And so now it is done under anesthesia, and so they put you to sleep whenever you get ECT, and it can be a really safe and effective treatment. In fact, all three of these medicines can be.
So do you have any drawbacks or barriers to any of these new treatment options that we should know about?
Yes. So one of the main drawbacks to all three of these medicines really is that they often do have to be administered in the doctor's office or at the hospital.
Okay.
So it's not something that you can just send home with a patient like a medication. And so you have to come up to the doctor's office, and often they require multiple treatments. So it may be something that you have to get reliable transportation to and be able to get to and from the doctor's office frequently and have the time to do that. The other thing is the anesthesia required for ECT, and so making sure that you have somebody that could bring you back and forth between appointments is going to be important.
Well, Dr. Kennedy, thank you so much for your time, and you're so easy to talk to. I might need to come and see you in my spare time.
Oh, for sure.